Psoriasis is a psychoneuroendocrine immune disorder. It is very common and it affects both the skin and the internal organs, mainly the joints. In the skin, psoriasis is really a devastating disorder from point of quality of life because there is redness, desquamation, itch, and this makes the life of the people affected by psoriasis very poor. So today there is a great effort in trying to find a solution for getting people rid of psoriasis because in this kind of era in which the image is self-explaining the overall personality of somebody, to be affected by this disease is to be affected by a sort of stigma. And because of this, I think that many studies and many new approaches are needed in order to put together both efficacy and safety for patients affected by psoriasis, without forgetting that psoriasis is usually a lifelong disease and is not easy to get rid of it. There are different types of psoriasis and the medical approach or physical approach is completely different. If psoriasis is very mild, we can use creams, only creams, and in 93% of the cases, sun exposure. And this is enough for treating localized and mild psoriasis. In the cases in which psoriasis becomes more aggressive, we have phototherapy, which is namely based on UVA and UVB narrowband 311 nanometers, and obviously creams for local use. Nowadays, people is concerned, and also the scientific community, by the long-lasting use of corticosteroids, because cortisonic creams are absorbed by the skin and they can give systemic side effects. For example, in the childhood, they can even produce dwarfing of the child, which will not grow up any longer. Nowadays, we also have to face with very severe forms of psoriasis. For this, obviously, creams remain the main approach for external use, but we need drugs from inside, and in this case we have three types of drugs. They can be anti-inflammatory drugs, immunosuppressant drugs, and the new so-called monoclonal antibodies, which are extremely expensive and are limited to a small subgroup of very severe cases of psoriasis. Psoriasis is a long-lasting disease, and so when we design a kind of treatment, any kind of treatment, we must keep in mind that this treatment should last for many years, even if this is unpredictable. This means that, as we know that creams, lotions, and ointments are absorbed by the human skin, we must be very careful which kind of creams, of lotions we use. We know that psoriatic skin is keen to absorb 10 times more than the normal skin. In other terms, if I put on the normal skin of a normal subject a corticosteroid cream, it will be absorbed 1. If I put it on a psoriatic skin, it will be absorbed 10 times more. This means that we must be extremely careful, always keeping in mind that the side effects are in front of us for the use, which must be long-lasting, years and several times decades. So, for this reason, there is a very wide new approach which is trying to go back to the centuries to identify which kind of treatment can be giving relief to the psoriatic skin and to the overall psoriatic patient. And we have found that there are many recipes, mainly based on natural substances extracted by flowers, by seeds, by plants, which are extremely well accepted by the patients because they do not bring any side effect and can be as effective or even more effective than the corticosteroid creams or the immunosuppressive creams. So the trend today is to go back to Mother Nature, to try to enter in a sort of new way of thinking and to emphasize that safety comes first. And when we can get more or less the same results without challenging the good health of patients, it's clear that the scientific community is and will be encouraged to use this kind of so-called natural treatments. The safest treatments of psoriasis are difficult to describe because according to the severity of psoriasis, according to the presence of comorbidities, from time to time we have a very strict, very narrow street to follow. And so we should go in depth into the different categories according to the severity. In general terms, phototherapy, mainly the narrowband phototherapy, is considered safe and effective treatment of psoriasis. We use usually corticosteroids and derivatives of vitamin D in creams for short periods because they can be absorbed. And then we use, for example, some natural treatments like spa treatments. There are specialized spa and springs places where psoriasis can be treated, and some special areas in the world, for example the Dead Sea, which are very well known for their efficacy and their relative safety. Obviously, this applies to those forms which are not that severe, but it is interesting to note that over 90% of the overall psoriatic patients, they do not need aggressive treatments and they do not need any kind of continuous internal treatment. So for these cases, a natural approach with well-known substances extracted from plants, from flowers, from seeds, can be considered nowadays as a winning approach. In our job as dermatologists, every day we have some new discoveries, and it happens that we will visit patients who are coming from foreign countries and have been treated or are being treated with substances we don't know, and mainly by patients which I saw a long time ago and still I see were treated with the Psoriatinex gel, cream and oil. That is a cosmetic kind of approach which proved to be extremely useful and extremely satisfactory for the patient without any side effects. This kind of Psoriatinex approach interested me very much. I tried to go in depth to understand what it was, and I was really surprised, amazed to see that there was nothing chemical inside, and it was just extract from natural seeds, natural flowers and natural plants. I got really interested into this field, and so I tried to speak, to approach my international colleagues, and I became even more amazed because I realized that international clinical trials had been carried out in very well-known and respected universities, in the University of Vienna, in Hungary University, in Romania University, in Russia University, and in many other parts of the world. So there was a very wide international experience on this psoriatic external treatment, natural, cosmetic external treatment, which resulted in an extremely positive result for the psoriatic skin without any side effects, and I realized how ignorant I was. What is amazing is that in the international studies, the good or excellent results are more prominent than those with the so-called pharmacological treatments. In the Austrian University of Vienna study, for example, there is a cleaning of the psoriatic patches in 87% of the patients without any side effects. And obviously, in front of this evidence, we are extremely grateful to Dr. Michael Tyrant from Australia, who was the one who started designing these products, assembling the different substances, and treating the first patients.